the leadership of the Uganda Medical Association has encouraged health workers to stay committed to serving Ugandans regardless of the challenges they encounter while on duty. Now, President of the Uganda Medical Association, Dr. Samuel Olede, who addressed journalists in Kampala, was grateful to the government for granting health workers the 495 billion shillings for their welfare. Take a look at the story.
Addressing journalists in Kampala, Dr. Samuel Oledu, the president of the Uganda Medical Association, was glad that government approved the 495 billion shillings in the 2022-2023 budget to accommodate for the welfare of doctors. The health sector, which is still largely donor-funded, even despite the grim reminder by way of COVID-19 pandemic, got a total allocation of 3.722 trillion shillings for healthcare delivery.
And we are glad that 495 billion was earmarked to see the welfare of all health workers across board. And in that same spirit, we are also glad that at least there was a budget increment for drugs and consumables in the hospitals from the usual 534 billion to the expected 700 billion.
Dr. Oledo said despite challenges that doctors face, they have the mandate to provide services for which they were trained for, hence encouraging them to remain committed to their work and exhibit the highest level of professionalism.
That at least where there is health issues, the health workers are going to be available, and we encourage all the health workers out there who are working in the different facilities, let's exhibit the highest level of professionalism, the highest level of ethical code of conduct. No one comes to hospital when they're fine. So let's give the service as it is due.
Doctors also appeal to government to implement the presidential directive of the deployment of all COVID-19 specialists that were sacked from government hospitals.
Your Excellency, we request that you use the same insight to overcome the powers of this Judas Iscariot, who is blocking our appointment into public service.
As of June 14, 2022, 90 cases of COVID-19 and 8 deaths were confirmed in Kampala only.